One of the reasons that the World Health Organization so vehemently supports the decriminalization of sex work is because they have good reason to believe that it could cut new HIV infections by 46%. HIV is spread through unprotected sex and intravenous drug use, and sex workers often engage in risky sexual practices not because they want to, but because they're forced to. And the criminalization of this work makes it a lot more likely that people engaged in this work will be forced into unprotected sex. Let's talk about why that is. First of all, where this work is criminalized, condoms are often used as evidence of a crime. What that means is that police officers, when they're arresting people, if they find you with condoms, they're more likely to arrest and prosecute you for prostitution. And so people, reasonable, rational people, forego carrying condoms, not because they don't want to be using protection, but because they want to avoid arrest. Another thing that's true, prohibition pushes this work further underground, and members of a criminalized class are a lot more likely to face violence, and they are less likely to have any recourse when advocating for safer sex practices. But where sex work is not illegal, it is a lot easier for sex workers to insist that clients use protection. Another way that decriminalizing sex work reduces new HIV infections and increases public health overall is that it helps sex workers tell their doctors the truth. Where this work is criminalized, sex workers are forced to lie to their care providers. They're forced to lie to their doctors. They're forced to lie to social workers, all to avoid arrest. But when this work is decriminalized, they're able to tell their doctors the truth. They're able to work with and seek out medical care, testing, and treatment without fear of arrest, which is why the World Health Organization and dozens of human rights organizations all support the decriminalization of sex work, because it's the only policy that improves public health and safety.